Callie, take it away.
Yes.
Are you ready?
Mm-hmm.
All right, hi everyone. I'm RaeAnn Anderson. I'm in School of Nursing. I am a psychologist and I'm in the Health Sciences Department. And I use the money to go to a conference to meet my wonderful collaborator, a clinician, the STAND Clinic, which stands for Sex Offender Treatment and Assessment of North Dakota, where she specializes in treating people who have been arrested or incarcerated for a sexual assault related offense. But to give a little background, so how many of y'all were in your roles as faculty in the 2010 when the 1 in 4 statistic really took off, that 1 in 4 college women experienced sexual assault? President Obama and President Biden had task force related to this. There was some specialized funding from the National Institute of Justice, and the research with college students and sexual assault started in the 70s, but really kicked off and kind of went to the next level in that time period. And that's the perspective I was trained in. On the kind of other side of the equation is folks like my practitioner colleague, Dr. Benson, who work with folks in the criminal justice system, right? People who have been arrested for doing sexual assault related crimes. And her clinic, they take both people who are currently incarcerated, but also people who have been arrested and they're on probation, in a diversion program. In some way, they are being politely mandated to treatment. And that research grew a little earlier in the kind of thinking of the history of the scholarship in that area. That research area has been around a lot longer. And we're all trying to solve the problem of sexual assault. We have a lot in common in terms of the reasons we're called to do this research, the kinds of questions we're asking. But in reality, these two research areas, these two practice areas, are not interacting very much. It's very much siloed. And this area of research, those working directly with justice-involved folks, there's been huge leaps forward in that research focusing on treatment. When folks get mandated to treatment or when folks choose to do treatment, what happens? How do they change? And it's really a giant leap in public health that we now have effective treatment programs for sexual offending behavior. That did not used to be true. That was a tough nut to crack, and kudos to them. On the other side, folks who focus more on college students, you've seen a really big progress in understanding the etiology and the origin of these behaviors. What are the risk factors? How are these risk factors interacting? At what point in life are these risk factors starting? What situations are these things occurring in? That's been the strength of this research area. And my goal in this kind of phase of my research is to be getting things closer together. We have had this incredible progress in treatment that has really not touched the campus or community focused folks. Nobody ever offered to teach me how to do that treatment. I'm a licensed psychologist. I've literally never had the opportunity to learn how to do this in spite of doing this research for almost 15 years now. Like there's really separate worlds. But are there things that we've learned from treating offenders that could be informing prevention on campuses and in high schools? I can't imagine there isn't. So that's one of my goals at this stage, is to be learning more about what do those treatments look like, what are those practitioners doing, how can we translate that into prevention in a more universal setting. And I specifically used the early career funds to attend this conference and learn about these things just because it has just been so separate. I've been told by multiple leaders in the field that, well, you don't need to know anything about that. That's completely unrelated. That's an entirely different population of people who perpetrate sexual assault. And I'm like, oh, okay. I'm a grad student. And the longer I went on, the more I was like, well, where's the citation for that? As Sarah Patel was mentioning, where's the citation for that? And you're going back, and you're going back, and you're going back. And I'll get to it in a second. Here, I found two. I found two citations for that. So really trying to bring these things more together, because how many people are arrested and incarcerated for sexual offending? It depends on the state and your jurisdiction and all things like that, but it's between less than 1% and less than 5%. What are the number of college men and women who are engaging in these behaviors? It's more like 1 in 4. It's a much higher number. So are these two different populations? Are they the same? In what ways do they differ? That's what I'm really curious about. So those two studies, I'll briefly touch on how they informed my study. First was this Woodman study where they did a community survey. So they sent out questionnaire packets. They found this was in a jurisdiction that has registry laws. So they pulled out the registry for their area and they sent questionnaire packets out to 40 men in their area who'd been convicted of sex offenses. And then they found 49 demographically matched men from the same community, sent them the same questionnaire packet. And importantly, when we're asking people about these behaviors and experiences, we are not saying, have you ever raped someone? Because no one would answer that question truthfully. Instead, we're using lists of behaviorally specific descriptions. So, have you ever taken advantage of someone who was intoxicated to have sex? Or how many times have you ever argued with someone and pressured them to get them to have sex with you, even if they didn't want to? So we give lists of these kinds of questions. So we're never using the word sexual assault. We're not using the word rape. We are describing experiences and they can check a box. And so, we're comparing these folks, talking about specific behaviors. There was no difference in the type of tactics used. So, no difference in whether people reported using physical force, reported taking advantage of someone who'd been drinking, verbally pressuring people. There was no difference in the type of acts in terms of whether they pressured somebody to have oral sex or vaginal sex or touched them over their clothing, groped them. Nor was there a difference in the number of times that people said they did these things. So I think of this kind of study as a comparison of the folks Law and Order SVU told you about versus the folks that actually live near you. And this study suggested there's not a difference. But that's just one study. The other study I could find is from 1988, and this was a comparison of 400 folks who were in treatment for sexual offending. So that included a range of things. 92 college students that were recruited from the same area, and 35 community members. And I mentioned this kind of underlying assumption that, well, these are two different groups of people, and you don't really need to learn about them. This study also highlights some of the other operating assumptions. I could find nowhere in the actual text. It's like, okay, well, how many of the participants were men and how many were women? It's just never mentioned. It's presumed that they are all men because we're studying sexual offending. And their analyses, they mostly did a kind of 4-group comparison, separating that sex offender sample into offenses that involved actual physical contact and those that did not, compared to the student and the college student and the community samples. And the main difference they found was that people were in treatment who were slightly older in age, reported less education. There were a couple differences between non-touch offending, so people who were doing things like voyeurism or exhibitionism compared to the students. But There was one difference between the touch offenders and the college students and the community, and it was on something like the number of hours you spend thinking about this. It was not the kind of big characteristic difference you're really kind of thinking of. But the drawback of this study was that these researchers were really interested in exhibitionism, so they weren't asking a ton of details about the more touch-related offenses that I'm interested in. So these two studies did not, really 2 studies over decades is really just not a lot to write home about in terms of, is this a supported assumption? Are there characteristic, fundamental, qualitative differences between folks who get arrested or incarcerated for taking advantage of someone when they're too intoxicated to consent versus college students who do the same thing? Just 2 studies, I don't know. So I considered this exploratory. And we examined the differences in risk factors between those who sexually perpetrate who we recruited from a college campus, who we recruited online, nationwide, that I'm calling the community sample, and then folks from a sexual offending treatment program. And we examined differences in their substance use. That's a big variable when we think about college students, but also their sexual funding or sexual functioning, and then their sexual assault history. So thinking more about the characteristics of their experiences. How did we get this data is a question I could give you a whole nother talk on how we actually get folks to tell us about these things. So I'm sorry that I'm being very brief today. We actually interviewed all of these folks. So we got, and that was because we wanted to get the details of those experiences. And that's hard to get in just a survey study. So we actually did Zoom interviews or phone interviews with the folks here. And that is 130 folks altogether in this data set, 62 of them being college students, 52 community, and 20 folks from the sex offending treatment program. 40% were women, 35% were cisgender men, 13.5 trans or gender expansive gender identities, 54% heterosexual or straight, and then about 57% identified as white. So again, very brief demographics that we can say more about, but I only have 20 minutes with you all. To get to us, they saw an online ad, and they clicked on that ad, completed a eligibility questionnaire to screen, did they have an experience to talk with us about? If they seemed eligible, they were then directed to a separate website where we had a description of the study, photos and names of our interviewers, and then they could pick a time of when they wanted to talk to us. So if they really only wanted to talk to another man, they could see who that person was and pick that person's time. And then when they came to that Zoom or phone call, we had them complete these experience questionnaires again. And if they had more than one experience, we asked them to tell us about the most recent. And if they had multiple experiences, then secondly, tell us about the most memorable experience. After doing that interview with us, where they were asked to describe what happened, what was the age group of the other person involved, where did this happen, just kind of asking after that basic description, making sure we were filling in some of those key details, then we gave them an online questionnaire battery. So what did we find? Demographically, our college students were younger and included women. Our sex offender sample was 100% men, whereas our community and college student sample was more equally split. Not exactly equal, like 40, 60-ish. And college students reported drinking more in the past month. Not surprising, particularly because this treatment program encourages people to be completely abstinent from substances. So folks already in treatment are telling us that they're drinking less than folks who are not. But Absolutely no difference in relationship status, sexual orientation, race or ethnicity, number of drinks in the past month, number of times binge drinking in the past month, difficulty stopping drinking, past month drug use for 10 different classes of drugs. No difference. And I'll note here, people are getting the questionnaires after they've done the interview, and we're just giving them the packet and then saying, peace out, goodbye, thank you for your time. We're not like watching them fill out these substance use questionnaires. We don't, and the treatment folks, we're not their therapists, and this data is not getting back to their therapists. So we try to really minimize any demand to respond a certain way. So secondly, thinking about sexual functioning. Big old goose egg. Absolutely no differences. Or no, and I put these here just to say that, like, yeah, I did check things. We looked at sexual satisfaction, what their beliefs were about consent, what kind of consent cues they reported they used. Okay, how would you know somebody is consenting? What are you looking for? Their own experiences of consent. When you know you're consenting, how are you communicating that? Nothing. Also nothing different when we looked at the questionnaires regarding people's own experiences of being a victim. Again, giving folks a big long list of different kinds of experiences, different behaviors. Have you ever experienced something like this? We also particularly separated out things that happened in childhood before age 14 versus in adolescent or adulthood. Nothing. No differences. And indeed, the number of people who reported they'd been victimized since age 14 was 100% in all three groups, which was very surprising to me. I didn't expect it to be a small number. I didn't expect it to be 100%. Finally, the characteristics of perpetration. The things they did. The things that they signed up to talk to us about. And I'd kind of gone into this thinking about, Law and Order, SVU, and all of those kinds of images forwarded to us from the media that we're going to see that these folks are more physically violent. And that's why they're getting reported and arrested. They're assaulting younger people. That's why they're getting reported and arrested. No. No differences in the use of physical force, using substances, using verbal pressure. No difference in their age at when they started doing these things. No differences in their perception of how much the person they victimized consented. Nothing. So in all, I made 37 different comparisons to tell you that they were different in age, gender, and past month alcohol use. Which is a whole lot of nothing, really, in terms of thinking about how are these groups different? Why are they different? How might we need to approach things differently? This really floored me. Even though the two prior studies were not finding differences, I've been told by so many experts and people I admire, oh, you don't need to learn about that. Totally different population. What? In fact, they appear to be the same. It in fact appears that the main difference between people who are arrested and incarcerated for sex offending is random. Right? If we can't identify a difference, that goes back to randomness. What does this tell us for the future? It tells us that there's a lot that folks doing more college and community-oriented work can learn from the sex offending world. Right? But they've figured out treatment. How can we translate that to prevention? For example, there is, in fact, a specific protocol developed by sex offender treatment specialists for prevention that we could all be using. It could be implemented on campuses like ours. I think this also says that we need to really reduce the stigma towards sex offending treatment. Right now, very few people who are engaging in these behaviors are getting any treatment or experiencing any consequences of doing that. And that's partially because we have this societal belief that it's so uncommon. Well, we have lots of data that is not. So how do we get this treatment more available? Part of that is destigmatizing the nature of going to this treatment so that people will go. Similar to thinking about things like drunk driving, right? If it's a stigmatized thing that only evil bad people do, nobody's going to go to AA. Of course, again, it's much like drunk driving. That's also a, delicate needle to thread. We don't want zero stigma. Further, these similarities across groups say that there are the same root causes, that all this ideological work that's been done with college men, that applies to other groups too. They're not fundamentally different. So let's focus prevention there. That suggests things like comprehensive sex education, conflict resolution, universal child abuse prevention, lots of things that we could be starting earlier in life, making available to everyone that could reduce the prevalence of sexual assault. And really notably, in the sex offending treatment world, they talk about substances as a facilitator of sexual assault, not as a root cause of sexual assault behavior, right? It's really not letting people off the hook for drinking. Can we transfer that attitude, that kind of messaging to the community and to college campuses? So finally, this was also a small sample, just 20 sex offenders from the treatment program. So we're limited in some of the statistical comparisons we could make. And they were all from one clinic and one program. It's possible that there's something about folks in this treatment program from eastern North Dakota that's fundamentally different, and we would find something different with a different population or different sample. And we couldn't ask about every single risk factor either. So there may be it's just that these risk factors are not the things that are determinative and that are different, but it's other stuff. And so, thank you all. I got to present this research at ATSA, which is the main conference for practitioners who do sex offending treatment work and who do that research. So it was really interesting and illuminating to be at that conference and hear these folks talking about their work and talking about their research and make those connections. Including, what was especially important to me, getting to actually meet my collaborator, Dr. Benson, because this study started during Zoom and the pandemic. I had actually never met her in person. So it was lovely to get to meet her in person so that I can hopefully maintain this collaborative relationship even we don't live in the same place anymore. And it was really lovely that she was actually being given a Lifetime Achievement Award and a keynote at the conference. So it was lovely to get to see her receive that award and support her in that. So I know I flew through that, and I would love to hear what questions you have.
Okay, so I guess I'm coming from this with a biased point of view that men sexually assault women. Whereas
That is not an uncommon scenario.
I mean, but the women that were in your study had perpetrated sexual assault.
Mm-hmm. So when we were recruiting, we were just purposely trying to make sure we didn't get only men signing up. So we can't really speak to the prevalence of sex offending among women.
Okay, so your 40% women was just because you went looking for them rather than...
Right. Although other research I do suggests that it's way more common among women than historically the data has suggested, but still not quite as common.
What's the repeat rate, or not, let me back up, recidivism rate of people who have undergone treatment?
Oh, let's see. So it depends a bit, of course, on how you define that. Are you going by rearrest, or new conviction for the same offense, any conviction, right? So the caveat that it kind of depends on how you're defining it and how long of a time period are you looking at. But the meta-analyses put the rate of recidivism for people in sex offending treatment programs over an average of 3 years at 8%. So it's low, but grows over time, and that number gets bigger if you start counting non-sexual related offenses.
Okay, is that for the STARZA program?
For STARZA, STARZA sees pretty, because they're asking about behaviors, not just arrests, they're seeing much smaller numbers. And that's one of the big criticisms and one of the things that's really hard to translate between these two fields is folks who are doing justice involved work, they're relying on official criminal justice records. I'm like, why would you do that? Right, from my perspective, working with community and college folks, I would never ask about arrest rates because I know I would be only capturing like 5% of the people that have done the thing. So that's a big piece of things that's lost in translation between the two areas. And I'm trying to get some money to do a study where we give the actual behavioral questionnaires to folks in sex offending treatment to see if we can get a better sense of, are these behaviors, how much are the behaviors changing that are going along with those arrest rates? We just don't really know. We're kind of assuming and guessing that those behaviors are also dramatically decreasing because getting arrested again is a pretty big consequence you would want to avoid, but we don't know. We don't really know. Does that answer your question?
Yeah. Thank you.
I'm amazed that you don't find
Anything.
anything.
I put that, I put this image because I still feel this way. Even though I knew there were just these two studies, and these two studies were suggesting there wouldn't really be any differences, and I, framed all my analyses as exploratory, I still thought that physical violence, that you're you are choking or punching someone, at least that would probably be different.
Societal expectations and
I've watched too much Law and Order. That's my conclusion.
Too much television.
And I think that's a really key prevention piece going forward, is to try to advocate for media that is more realistic to what actually happens in sexual assault.
Is there any evidence out there that shows with a history of being a victim causes you to victimize? Because in yours you said you were surprised it was 100%.
So there is a large literature on that. And it tends to be, if you look at the meta-analyses and things like that, pretty consistently significant. If you were sexually abused as a child, you are more likely to sexually perpetrate as an adult. So it's pretty consistently a thing, but a small effect size. It's it is part of this equation, but it's not the big kahuna. And you tend to see similar effect sizes when you look at other forms of child abuse as well. So were you hit by your parents? Were you called names by your parents? Were you neglected? Those all have similar predictive power for perpetration. So it seems that it's not so much about the sexual abuse itself, but more of being mistreated by humans who are supposed to care about you. It means that you are less likely to be a conscientious, considerate human in your own behavior. Sue?
Right, yeah. So in some situations that we try to prevent things from happening, and there's not just one thing that you can identify, maybe it's multifactorial in that if there are groups of positive identifiers or factors that you looked at, did you look at groups to see if maybe if you did this, this, and this, then that would show maybe a more potential to be a sexual offender?
Like if we looked at severity groups or something like that.
Yeah.
That's
yeah.
interesting. I have not done that.
that might be something to do. And
Yeah.
with the STARS Up program, if you can't identify people who are more at risk of being perpetrators, how can you devise a program that is supposed to be preventive
Yeah.
if you don't know what you're preventing?
Right. So there's effective prevention, I would say, does not yet exist. If we're going by
We're just
the
guessing.
standards of my field, that there have been 2 separate independent clinical trials that show a significant effect size in changing this behavior, that does not yet exist. There have been studies here and there, coaching boys into men. There was a very large statewide, across the state of Pennsylvania, study of that program with adolescent boys that did suggest a significant change in reducing perpetration behavior. That was 1 RCT by 1 team. We need to replicate that. So I think there's a couple promising things like that, but there's also a larger literature of when college campuses, and this is historically was very popular, do things like attitude change programs where they talk to people about gender norms and changing those behaviors. You actually make things worse. People do not, the folks who perpetrate do not want to hear about gender equality and about how they need to be more conscientious and that they don't know how to ask about consent. They are not interested in that message, and it actually makes things worse. So that is the really tricky part of trying to develop new prevention programs is, well, we know about all these risk factors, but they tend to be more of these social cognitive things. How do you change that without triggering some of this defensive reactance? One thing I'm really curious about is that none of these prior studies acknowledge that a lot of the folks in the room during these prevention programs have a victimization history. Probably one that no one has ever asked them about. Probably one that they themselves dismiss as irrelevant and unimportant, and definitely not relevant to how they think of themselves as a man or their sexuality. If we start acknowledging that and giving people ways to think about and talk about that experience while we are also talking about prevention of perpetration, can that maybe move the needle? Is part of this defensiveness that these folks, many of them have also been harmed, and that's not being addressed. So that's one idea, I think, for going forward. My other kind of idea for going forward is to focus more on sexuality and, like, do you want to have more sex? Do you want to have quality sex? Well, then you got to talk about it. You got to ask your partner what they're interested in. You have to think carefully for yourself. What are you interested in? What do you want to do? You probably don't want to drink because that's going to decrease your risk of orgasm, or your benefit of orgasm, not risk. We've kind of, previous prevention programs has been kind of divorced from the sex part. But the sex part is what people are actually interested in. So if we make it about that, maybe that's how we get people in the room. I don't know.
Yeah,
Big Wild West.
Yeah, I've heard that perpetrators are not really interested in the sexual gratification of the situation. It's more of power and interpersonal violence.
That's a bit of a myth in that folks who perpetrate, they're a heterogeneous, highly variable group like anyone else. So some of them, yes, are very interested in that power and control and showing their dominance. Some of them are not interested in that, and they just want to get laid, and they don't really care how it happens, just that it happens. Right? So there's a variety of motives, and that's definitely true for some, but really not for others. That's part of the conundrum too. So there's lots of different things that are going into why this occurs. Other questions, folks have?
Well, it's just an observation. I actually was shocked that you got as many people as you did online to go and speak to someone that they do not know at all and bare their souls. It's hard enough to do it with someone that you know well. I mean, I find it shocking.
I would
It's easier
too.
to do with someone you don't even know.
Yeah, but I mean, you
That's
don't
what
know
they
who
thought
they
was
know.
easier.
Do you know what I
Right.
mean? Like,
Because there's less judgment if it's someone you don't know.
Well, I can tell you that it took 5 years to collect this data,
Oh, I bet.
and our no-show rates were through the roof.
yeah, because maybe they wanted to talk to somebody, but they were fearful,
Yep.
Yeah.
Yeah.
and that kept them away.
Yeah. So
You know?
we recruited. We used kind of 2 sets of ads for recruiting. Some ads focused on victimization experiences. Some focused on perpetration experiences. Our no-show rate for victimization interviews was around 50%. And I found that in other studies too, where we're interviewing folks who've been harmed. Particularly when you think of it broadly and you're trying to include people who don't call it sexual assault. They're just like, I don't know, this weird thing happened. Sure, I'll talk to you about it for $20. No-show rate is like 50%. For our perpetration interviews, our no-show rate was like 70 to 80%. That we just had to assume that we were going to have to, once we got somebody to sign up, reach out to them multiple times. Most people were never going to reply and we're going to cancel their appointment and just keep going until people showed up. And actually, we, part of the reason that victimization history rate is 100% is because after we were going for a little while and observing this no-show rate, we was like, okay, statistically, probably like 30 to 40% of people who are doing our victimization interviews also have this experience. Let's see if we can get some of them in. Those folks were much more likely to show up to their appointments because they'd already talked with us once. They already knew we were going to be nice to them and non-judgmental. Almost every single person in the treatment program who called for initial information showed up. So we would have had probably more like, instead of 130 people, probably more like 70 if we had not been able to capture folks from some of these other avenues. 'Cause yeah, people do not want to show up and talk about this. But having done survey research where I tried to get people to just tell me about it in a questionnaire, they also don't tell you about it in a questionnaire, or at least not in the detail we were really wanting to get. So yeah, it's
Hard area to study.
very, very. When Sarah was talking about, what does she need funding for? I'm like, what do I need funding for? I need funding to be able to pay a research assistant to be there 90% more often than they're actually going to be doing the job I want them to do because of no-show rates and being able to pay participants. Well, thank you. You've been a lovely audience.
Thank you.
Thank you.
Wonderful.